Actually, the pain started about a year and a half ago. I was getting some pain in the thigh area, in the thigh itself. Sometimes I felt like I was being stabbed in the thigh, as if I had a ice pick sticking in my buttock. And the strange thing is that the pain is never in the hip. It's everywhere but the hip area. Some days are good, and some days I just, I have to actually stop for several minutes because I just kind of like freeze in place. Sometimes the sensation of the pain just wants to make my knees buckle, and I have to take 15 to 20 seconds before I could start to proceed again.
I looked at your x-rays again, and you have, bad arthritis in your hip. And
He said there were only two things you can do. We do it or we don't do it. And I can't see not doing it as some sort of option.
so I'm going to cut the ball here, like that, right across the neck, remember, and the ball's coming out.
Right.
And then I'm going to carve out a new socket for you here, because that's all irregular and you got all these spurs. So I'm going to remove those. I'm going to create a whole new, brand new surface for you there. And then I'm going to open up this canal here, and then that stem piece I showed you is going to go down in there.
I see.
And the ceramic ball is going to fit perfectly against that new shell. This is how this thing actually fits together. You're going to move your hip. An average man like yourself is going to move your hip 1.5 million to 2 million cycles a year. So whatever surfaces you put into contact, there's going to be some wear. The success rate with hip replacement is in the order of 97 to 98%. So this is a highly successful operation.
It's a no-brainer, really. When you have a problem like that, and there are procedures that can alleviate whatever problems you're having, it doesn't make much sense not to get relief. Right, we're on the way. It's starting to kick in now. 1 week to go.
I'm going to clean your arm.
Normally, I'm a very, very calm and collected person, but as it's getting a little bit closer, I feel just a tinge apprehensive. I've never had surgery before. It's starting to sink in now. It's, it hasn't bothered me at all, and now it's starting to sink in that it's imminent.
How you doing? You look good. You're pretty relaxed. You look very relaxed right now.
He is. I'm the one who's neurotic.
Are you really? Yeah, he'll be fine. Not to worry. So I'll see you in a little bit. Don't worry about anything. I'll call you.
All right, thank you.
That's work.
First time, huh?
We went through the process in the what they call the staging area. They prepped me in the room. They shaved my leg, and we just waited for the surgery to begin.
Hello.
Hi, I'm
How
his
are you?
wife. How are you doing?
Perfect.
Okay.
So you're ready?
I'm ready.
Bye. Good luck.
Thank you. Yes.
I remember being wheeled to the operating room, being placed on the operating table, and the next thing I remember was being in the recovery room.
Anybody who's had an arthritic hip or knee, you can't walk more than a block or so. It really wakes up every day with pain. It's a very disabling thing. It's interesting, arthritis is one of the most common chronic diseases that we have. Sometimes it's not as calamitous as some other diseases. You have heart disease or cancer or AIDS. They're more life-threatening, but certainly arthritic disease tremendously compromises what people can do. And it really interferes with their life. And it's far more common than any of those other diseases. It's a very disabling thing to be 58 years old and not be able to function. In the prime of your life. Here, the lap. So this is the head of the femur, and you see there's no cartilage there, that's bone. No cartilage at all worn out. See right there? See, this is the remnant of cartilage there, but essentially there's nothing. Here's a little cartilage here, but you see there's nothing there. That's bone. There should be 6-7 millimeters of cartilage over that. So that's an ugly hip.
I just want to start and get through this and reach the point of full recovery.
Thank you.
It'll be strange to be able to walk without limping. The limp becomes part of you after so long.
So, how you doing? How was your night?
Fine.
Good. Much pain last night?
No, not at all.
You moving your toes up and down, wiggling everything? Good. Did you drink much?
Only 10 cc's.
Wow. You know, the reconstruction looks super, and the x-ray looks great. So get you up walking today. All right? You'll be ready to go. Questions at all?
Looking forward to it. There's no pain or anything. I'm really surprised. And I'm not on any pain medication. Just a slight little soreness, but that's all.
You were always good with pain. I'm the one who's not good.
There are procedures that can alleviate the condition.
Just take a rest for a moment. We're going to change to the crutches. Okay, we're going to put one crutch in one hand.
You back to it?
Yes.
And it's relatively simple in today's day and age with the technology. It just doesn't make sense not to do it.
Crutches first, then take a step with your right foot. So let's go over to the steps.
I didn't want to continue with the limp and the pain and the handicap. You don't like to think of yourself as a handicapped person. I would imagine I was.
Go up the step, you're going to go up with your good leg first.
How you feeling with it? With the steps?
Yeah.
You're going to come down with the crutch first. Crutch. Excellent. How does it feel?
Fine.
Good.
This has all gone a lot easier than I thought it would. Very surprised. I'll be able to walk without pain, no limp, no pain. Be able to do a lot of walking, be able to play golf, and just get back to a more normal life. I expect to be back as quickly as possible. Everybody's told me that the rehab is very, very, very important, and I'm a very disciplined person. When it comes to that type of thing, I intend to do whatever I have to do to get back to normal as quickly as possible.
6. It doesn't hurt you as bad.
No, not at all.
7.
The first visit, we went halfway up this block over here. Not too far, maybe 100 yards or so. And then each time, you know, he came, we extended it in. At one point, we started going around the block.
In fact, we're going to be discharging Gene pretty soon. And that's very good.
I plan to return to work in 2 weeks. I don't know if I'll be ready to play golf at that point.
Well, if you have to show the doctor that you can do it.
Maybe this will improve my game tremendously, this new hip. Take a frontal shot. The whole secret to coming back quickly is to do the exercises and get the muscles built up as quickly as possible.
All right.
The repaired leg looks like it's much shorter than the good one. See this compared to this here?
Mr. Zimbrodi.
How you doing?
Nice to see you. How are you?
Feel great.
You doing okay?
Yeah, absolutely.
Super. All the precautions are done. So you can lie on the operating side, sit in any chair you want, do away with the elevated toilet seat, do away with the pillow at night.
It's probably just my imagination. The operated leg, when I'm walking, feels as if it's long.
Yeah, it always does.
It has.
Yeah, that'll pass. And so it'll take another 4 to 6 weeks, but that'll pass.
I see.
Let me just see the cut. Let me just see that incision. So it hasn't been too bad, huh? This whole thing?
Not at all. No.
Super. No problem. You actually don't have much swelling at all. Now, this is solid titanium. So you see how close I got that metal? This is titanium right up against the bone. So when I get a fit like that, I can let you walk on this thing right away. That's why you can walk so quickly.
I walk faster now than I did before I even had a hip problem. This is the best thing that I've done. I feel like 100% different person.
He can swing a lot better without him hopping when he swings. He used to hop because of the pain.
The funny part is that people that I work with, after I got back, they said that I looked good, and I couldn't understand what they meant by that. I said I had a hip replacement. The point that we're trying to make was that there was something on my face from being in that constant pain. It does affect you to the point where it shows on your face, and once the pain is gone, you take a whole new look on yourself.
In the hole! In the hole!
Actually, what happens now is when I see somebody limping down in Manhattan while I'm walking along the sidewalk, I feel like tapping them on the shoulder and saying, I think you should go and have your hip checked because I went through what you're going through.